Even before the pandemic began last year, the topic of health and accessibility has been a primary concern for many of us. However, as COVID-19 remains as a threat, health inequities have been surfacing to the forefront, especially among communities of color. I spoke with Dr. Vanessa E. Martinez Renuncio, professor of anthropology at Holyoke Community College, to gain insight on how these inequities have existed historically in communities of color and what solutions can be offered to help improve the lives of the residents who reside within them.
For communities of color, we're seeing higher rates of illness, higher rates of death. Unfortunately, that pattern isn't new, and we see it with chronic disease and infectious disease historically for communities of color. So, COVID is just following the pattern that we've seen, the health inequities that we've seen for communities of color. Um, so, it's really about understanding the why. And there's a lot of people now talking about the why, and the why not being racial genetics or the biology of people of color, but rather the ways in which institutional racism, the environment, right? The neighborhoods, right? Low resource neighborhoods that you're seeing, sort of large communities of color being in these low resource neighborhoods, toxic environment. So thinking about issues of climate change, so you're seeing more and more people having these connections, but unfortunately it doesn't seem to fully uh, dissipate the misinformation or the fake information or incomplete information that we still have around sort of this idea that it's in the biology of people of color, or there's something in the bones, or there's something in the culture. But instead it's really about understanding institutional oppression and low resources in communities.
How do social inequities impact access to medical care and educational opportunities in ways that might not be so obvious?
I think it's easier for people to understand sort of um the person who blocks you from getting a job or who calls you a bad name. It's much harder to understand the ways in which institutions like education, and believe me, I'm a higher ed professor, but right, the ways in which education or the media or our government really work together um, in ways to really block access. And you know part of the talk that I gave was about thinking about the ways that we can hold um, our policymakers accountable, right? And think about the way, not just in implementing policies, but also in following them through, right? Like really understanding, okay, we need to make this change. How much change do we make? Um, and how do we ensure that it's happening, right? That these changes are happening.
As a trained cultural and medical anthropologist, you describe your approach as using a historical lens and an anti racist perspective. What does that mean, and why is it important for you to use this approach?
History allows us to see patterns, but I think the historical perspective is really important to understanding today, and to understand both the things that have not changed and the ways in which change has happened, right? In terms of an anti racist lens, I think that race first perspective really allows me to better engage, not just in communities of color as a Latina with light skin, right? But also in white communities, and being able to talk about these issues and really push people to engage in ways that are meaningful, but also push them out of their comfort zone, right? So in my talk, I spoke about the growth model, which is not my own, but um, it sort of makes an argument, right, that when we're in our comfort zone, we don't necessarily engage with new information because we're comfortable. That's where we want to stay, right? But if we move to a stretch zone, a place where new information is possible, we can engage. It's innovative, right? It's a place where you can think of new ideas and innovation and creative ways to strategize, right? Like one of my colleagues posted something on Facebook about creating an anti-racist reading group in Holyoke and asked for facilitators for the community, right? And this is, post George Floyd, and I said, sure. So I engaged a colleague of mine and a friend, and we are, we are co-facilitating anti-racist book club, right? Like reading together and having a discussion and bringing it to the local level. Like how does this impact our local community here in Holyoke? So I think those are the types of things that I want people to really think about when they're uh, engaging with new information. How can they make a difference? That's really the point. How can you make a difference?
Are there any communities where progress has been made to equalize some of these inequities, and what can we learn from them?
What I can tell you is we see that throughout history where progress has been made. So, for example, the during Reconstruction, is a great place to see, okay, Blacks gain some access into government, into having small businesses, into, right, and then we saw sort of a shutdown of those resources, of that experience. And then we see post civil rights, Fair Housing Act. We see, right, a variety of legislation that really benefited people of color and communities of color. And then we saw a backlash, in the late 70s, early 80s, right? And so what we know is that with progress comes a backlash. And so we have to fight against those backlashes, because what history has shown us is that we're not always just moving forward. We are moving in a direction, let's call it forward, and people push us back, and we move a little bit forward and people push us back. So what history has taught us is to just keep moving forward and address the backlashes when they happen, right? Whatever those look like. So if you're me, you are giving talks like this, you are teaching courses, you are engaging with research in Springfield on climate change and racial justice, you are, right? And so I am hoping that the work that I do with my students, the service learning project that the students are doing with the organization that I work with, that they are learning, right, this information, and that they then pay it forward. And that is my hope.